Welcome, everyone. I'm Melissa Secord, the National Executive Director for the Canadian Celiac Association. For our regular viewers, you may be wondering where our normal host, Mark Johnson, is, and we've decided to give Mark a break this month after he worked double duty for our annual virtual conference program just the other week. I am fortunate to be joined by Matthew Bown, and Matthew is an Associate Director of the Bureau of Policy, Risk Management and Stakeholder Engagement in the Natural and Non-Prescription Health Products Directorate. That's quite a handful on that business card. Welcome, Matthew.
Thanks for having us.
This is one of our In Conversation installments for you on matters related to celiac disease and gluten disorders. And we bring you these conversations as part of our bi-monthly CCA Connects newsletters, which are also available on our website. We've been talking to research, industry, government, and stakeholder leaders about issues facing people with celiac disease, and we're pleased to have Matthew here today with us. Matthew, just tell us a little bit about yourself and your role in Health Canada. Tell us about that big, long title that you've got, and the mandate for your department.
Absolutely. So our group is fundamentally responsible for making sure that anything that's non-prescription, being it natural or synthetic, that those products are safe, effective, and of high quality, and ultimately also available to Canadians who are very much taking a larger role in self-care than we've seen in any other period of time, and very much during COVID-19 as well. Myself, I was brought in 2016. I had spent some time here before, but I was brought in to work on what we called the self-care framework at that time. And really it had two big kind of drivers. One was making sure that Canadians were informed when making choices about the purchasing of self-care products. And the second one was making sure some of the very old regulatory structures that treat these products so differently, whether it be a lipstick or with an SPF or a toothpaste, it treats them very differently, even though ultimately the risks are the same. And so bringing some cohesion and coherence to those products.
That's great, and it's so amazing. You know, every day consumers just buy things, and the thought and care and the regulations that have to go into protecting them as they make their choices in their normal day-to-day life. So it's great to have Health Canada looking out for consumers in that way. So why did the government decide to update the labeling for natural health products? Is it part of a larger strategy for the government? And if yes, you know, what sort of research went into that to bring you to light of the changes?
Yeah, absolutely. So since 2016, we went out and we had a proposal in 2016, and we heard back quite loudly that people wanted to talk to us about what the elements of that self-care framework would look like. And so we, through research, through public opinion research, focus groups, we spoke to almost 1,000 people in person over a matter of about 6 months. And that from Halifax all the way to Victoria. And what we heard very loudly was Canadians were really concerned with the labeling of the natural health products. On occasion, it could be high caliber and the best in the world. But on other occasions, the font was very small, requiring magnification in order to read anything, including contraindications for taking those products if you have a heart condition or diabetes. And that consumers we're seeing poor contrast and no standardization. What we have right now is what you would call a narrative label, which is basically it tells a bit of a story of what the product contains, what it's for, and how to use it. But there was no standardization. People were using different titles for warnings. They were using different titles for directions. And so Canadians were really struggling with that. And unbeknownst to us, a very strong component of that was allergens. And consumers were very, very concerned, whether it be aspartame, whether it be gluten, whether it be the priority allergens as defined by Health Canada. People were really concerned about the presence of these products, coloring agents, fragrances, and the potential negative impacts and the harm that they were having on subpopulations of Canada. And this one really wasn't an expectation of us having gone out looking at trying to modernize some older frameworks. And so what we kind of put together in 2018 was a framework that looked at the consumer, number one issue for consumers that we heard from them first, which was labeling, and making sure that that NHP, the natural health product labeling, was at least sufficient for the Canadian to make an informed choice. And this is also driven by, back many years ago, you might remember we introduced the nutrition facts panel on food, and we now have a drug facts table on over-the-counter medications. And so people using natural health products versus OTCs, they don't know the difference. And why should they? It's why they pay people like ourselves. But ultimately, they deserve to have the information that they need to make an informed choice and to have safe use of the products. So that was the number one thing that the department kind of said, okay, if you're going to do this framework, we want you to do this one first.
Well, certainly with people with celiac disease, at least the ones that are associated or connected to our charity, is they're trained to look at labels and when they're purchasing products. So the fact that, when you're looking at products that you would consume that aren't food, great to hear that there's some standardization, because there's so much to look for, especially if you have an allergic reaction or you have celiac disease, to look out for, is this product safe for me to ingest? So I want to just have you classify or just sort of describe or categorize natural health products. What would that be to an average consumer when they're out shopping?
Yeah, absolutely. So a natural product is something that is naturally sourced or a synthetic creation of it. So it really is the things that are found in nature, even though it could be lab-based. It's the things that were found in nature once upon a time. And this came out of a large call for these types of products to be treated different than prescription products. And people wanted to see them have their own framework so that they could have access to the vitamins, the minerals, the supplements that they wanted, but couldn't get through the old regulatory structure that was there for non-prescription and prescription products. So what we're talking about here is a sunscreen with a natural ingredient, or one that was naturally sourced, toothpaste, it could be vitamins, minerals, hand sanitizer, which we all saw lots of over the last little bit.
Yeah.
Hand sanitizers that are alcohol-based or natural health products. And then on the other side, you would have a non-prescription drug. And this would be the things that you can't find in nature. So they're purely synthetic chemicals. And so the two of them kind of come together to make everything that we would see in a non-prescription space, including behind the counter here in Canada.
And that's those are everyday products. I mean, certainly for people with celiac disease, if they've had, we'll say, quote unquote, been glutened or become ill from a cross contact, they may reach for those natural health non-prescription products to relieve their symptoms. And they be, when you're most vulnerable and you're already sick, you don't want to become more sick from something that you thought was maybe healthy for you. So it sounds like, in terms of the current state of labeling, I guess it has been a bit of the Wild West. They've got, companies that have decided this is what they want to display. They were declaring allergens, but it was all over the map. That's basically what you're saying. And you're trying to standardize that information so that it's very clear and easy for someone to identify.
Yeah, I want you to be able to go to that label and know where that information is. We want to make sure that the right even names are used and language is used when identifying these products. I remember when I was in risk management years ago, Araxis oil came across my plate, and I'm like, I don't know what that is. Well, it's peanut oil. and Canadians, maybe someone with an allergy to it might know it, but not everyone's going to know what that is. And so we want to make sure that, one, that in the warning section, if you are allergic to celiac, or if you're celiac or allergic to gluten, if you are allergic to aspartame or any of the major priority allergens, that's right in the warning section for you, bolded, very clear under allergens. And that won't take away from it being in, say, a section where it's medicinal ingredients or non-medicinal. So it'll be in all the places, but we want to just pop it up right up top front, because sometimes the ingredients get tucked behind a little bit in some of the labeling, and it's a little harder to find. So we want it to be standardized that as you're reading down, you can see that information very early. And we think that that's, again, our role to make sure that these products are safe and effective. And it's not safe if someone's consuming a product they shouldn't be consuming.
Well, especially if you're newly diagnosed. For people with celiac disease, can be overwhelming and trying to understand, what is safe. So, structuring, the labels and making sure it's clear is really important. We've even come out with our own second version of a labeling guide, even for food, just because it can be very complicated. So any way to make it easy for the consumer. So in terms of like recommendations that have been moved forward, can you give us the kind of the highlights? I know as a stakeholder, you were looking for clear, certain, tables. Can you just outline that for our viewers?
Yeah, absolutely. So what we would like to see is ultimately a couple of main things. One is clarity. We want font size that's legible. We want a contrast of black on white, because you'll see some very interesting color combinations, and they're very difficult to read, especially if you're colorblind. We want to make sure that there's modern contact information on the package. Right now, the only requirement's to have a mailing address. And if you have an adverse reaction, that's quite some time for that to get released.
Who mails?
Yeah, who mails, right? And the other one is a table. And that table would be, again, a box on the back of the package that goes from, this is what the product's used for, these are the ingredients in it, this is what you have to look out, warnings and directions, and here's who you contact if something goes wrong. And so every single natural health product, and they're sitting in Shoppers or any store side by side with the non-prescription drugs, they would all have that standardization in terms of the nomenclature, but also the color and contrast.
Yeah, it's a lot. And for allergen labeling, is this something that's done in other countries to the same extent in Canada? I know we're amazing having some very progressive labeling in Canada, and a lot of countries do look to us. So can you tell us some of the changes that you've made specifically for allergen and gluten warnings, and maybe, just to help make consumers make that informed choice?
Yeah, absolutely. So I would say that we're being progressive in this space. And again, it's because we're listening to Canadians and what they have to say about their own health and health interests. And in this space, again, what we want to make sure is that if you're gluten intolerant or, again, a celiac, then again, as you're reading down, there will be a section that pops right out that says allergens. And in that section, there would have to be populated, gluten has to be specifically identified, aspartame has to be specifically identified, and then any of the other other priority allergens. And what we've heard a lot from Canadians from as well is concern around fragrances, concerns around coloring agents, and sulfites. So again, we're looking into, are there other things that need to be added there? That was never meant to be kind of a fait accompli. That's a starting point, and then it can grow over time as we establish what is in those products, the natural products on the Canadian market that could actually harm people. So again, it would be very prominent. It cannot come off the label. It cannot go to a website somewhere, and it has to be on the physical label to make sure that, again, as you're making that purchasing choice, that can come across. And we're seeing a huge transition to digital labeling, but we don't want to, we want to make sure that you don't have to pull up your phone to figure out whether there's a gluten in it or aspartame or, again, a priority allergen.
I think, as a stakeholder in some of the meetings we've held, and we had some great meetings with lots of different stakeholder groups, it was really important to understand when they were making that decision in front of at the product, is all the information there they need to make an informed choice. And I guess digital label would be, someone scanning a QR code and going off. But in terms of accessibility, ensuring that all of the people, at least in our community, if they don't have access to a phone, if they're a senior, or if they don't maybe have technology, which, a lot of people do, but it's important to be able to make that, that point of purchase. And just to confirm on the allergen warnings, it would literally kind of follow the food and drug labeling in terms of, it would identify wheat, rye, or barley. Is that correct?
That is absolutely correct. Thank you for that clarification. We are literally pointing to the food regulations and saying, do it like that. That's a well-established, well-researched, well-documented approach. And so we want that approach to be done. We have some other interesting ones too around sugars, because a lot of people will put a lot of sugar and sugar alternatives in their product and move them around so it doesn't look like we're requiring like products and like ingredients like that to be grouped so that you can ultimately figure out. I remember a doctor pointing out to me a weight loss product or a weight management product that actually you would gain more calories than you would lose by consuming the product. And so we want to make sure, again, that as you're buying those products, you can pick out that information. But absolutely, it'll be, we're looking at plain language, very clear, very well communicated to the consumer.
And I think for people with celiac disease, because food is, their medicine, the fact that the labels will hopefully, once approved, mimic the food because they've been, again, trained and educated to, look out for those ingredients that are in plain original sources. They know, and they know it's brow, wheat, rye, and barley, and those regular oats. So I think it's great. And I think also when we were discussing through the process, there's a bit of a concern over may contains or precautionary statements, and your team sort of alleviated our concerns that say that because of the required manufacturing at that level for these kinds of products, those manufacturing practices are pretty nailed down. So we'll never see a may contain probably on a label. Is that correct?
Yeah, I wouldn't say that you would never see one.
Okay.
What we're saying is so we're looking at a couple of models because I think people are still asking a lot of questions about that component actually. Okay. And what they want to know is, could this product contain the allergen, or again, is the GMP, the good manufacturing practices, are they in place that would prevent that? And so we're looking at a couple of models. Australians and New Zealand have been really progressive in this area. The Americans have been looking into this quite a bit. And again, if there's a chance that it's in there, what do we do? Maybe it does need a may contain, but if that ingredient's not on the premises, maybe you don't need a may contain. So we're really trying to look at how can we clearly provide guidance to industry. But yes, like you said, the manufacturing practices are quite high in this area, and we want to and we just actually announced about a year ago that we're going to start inspecting all of the sites. And so again, that on the ground, boots on the ground inspections really will make sure that these products are being well made. It would be a type 1 risk then, which is what we consider a risk that means you automatically have to recall that product. So again, containing lactose or wheat or something like that, that would be a very serious matter, and we would deal with that quite swiftly.
Yeah, and I think it's good to hear the extra intelligence on the ground with the inspections. That was certainly something we brought up, that it's one thing to say it's gluten-free, but really is it? And certainly there's certification programs, like we have one ourselves that carry our brand that are independently verified, but there's a lot of companies that will do self-declarations. And so it's great to hear that, would that be CFIA, or is that who kind of would run those inspections?
We have actually a little arm, that's not so little, but it's called the Regional Operation and Enforcement Branch. And they have health product inspectors. They have consumer product inspectors like cribs and lighters, and they have disinfectants inspectors. So we pretty much deal with anything that makes a health claim is going to fall within our purview, with the exception of functional foods, which again, that line's starting to blur, isn't it? Like more and more, it's not sure if it's a food or a drug. But yeah, so it is within our area, and we work really closely with them to make sure that, again, that as these types of risks are identified, that it's clearly demarcated or communicated that action needs to be taken swiftly, usually through a risk communication and or a recall. Certainly
with on the threshold, I mean, there is a threshold that's been declared for gluten, which is 20 parts per million for people with celiac disease, but obviously a little different if it's a wheat allergy or other allergies. I know there's some research being done about thresholds, and so it's interesting to hear work being done on the may contain and the other manufacturing processes. So definitely work to be done, sounds like, and we're still and happy to kind of be part of those conversations as well. So what is the estimated cost savings to the consumers? And there must be a lot, either, through, wrong product choices. If someone buys something and get it home and they realize, those kind of savings. What did your research find?
Our research found that there was a couple of areas, and first and foremost, I will admit it is hard to quantify in this area because would the risk have happened? Risk prevention is very difficult to cost. But where we found that there would be savings is consumers are willing to pay for allergen labeling. And so that, again, we're finding that Canadians will save by having that allergen information on that product and not choosing it or choosing it. Canadians were really concerned about not being able to read the information and then having that unintentional harm that was very avoidable through, again, clear reading of the labeling and making sure that there was health savings there. And the other one was incorrect purchases, whereby people are picking a homeopathic product, for instance, or traditional medicine, and not understanding the difference between that and, say, a scientifically assessed and clinically proven product. And I'll give you an example. There's Gravel Natural, and then there's Gravel, the traditional one we would know in the pink package. Most people actually think it's the same product, but one is ginger is the main ingredient, and the other one is not. And most people think it's ginger flavored, and so they incorrectly buy those purchases. And so when we did our research, we found that, again, Canadians are very much at risk for these types of risks. The problem is also it's very underreported, and I'm sure you probably see this even in your own community. When people are taking these products, they don't assume there's going to be a risk, and so sometimes they'll have an adverse drug reaction, but they won't report it. We suspect that we probably get about 2% of all the adverse reactions that happen. So again, it's really avoidable harm, making sure that people pick the right product. And that, again, that allergen labeling, we think that, again, people really want to see that, and they're willing to pay. And it's a very competitive market, as you can imagine. So we're hoping that those things will pay. In our regulatory impact assessment statement, which is on our website, those things are all kind of quantified and qualified. And we've also had some really great studies done by pharmacies and pharmacists that if they, in providing advice to consumers, in providing that information, that time savings in the healthcare system will be provided there. And finally, which should go without saying, someone doesn't experience a harm, that's a saving to the healthcare system. And again, we think that that's penultimately what we're trying to provide, and what we're trying to avoid is that impact on the healthcare system, because we don't want that to happen to the Canadian, and we think it's very avoidable.
Oh, definitely, definitely. As I said earlier, someone gets cross contact, they reach out to maybe get something that helps support their health, or they're taking a supplement, and you don't want to make them more, they lost time off work, or they're visiting a hospital. Certainly during COVID, that's the last place you want to be. You want to, the energy against the healthcare system, you want to minimize that. So CCA participate as a stakeholder in your consultations. What value to the process are patients and consumer stakeholders and feedback? You mentioned you went across Canada. You had different meetings. How does that help Health Canada? What does that bring to the table?
It provides balance, and we thank you very much for being participants, because we know that you have a full agenda and that many people are looking for your attention and your involvement in these types of things, because the patient is ultimately who we want to hear from. And we hear from other sources and other places very frequently and without even asking for it. And so it's really important for us to have a balance, because we're going to hear from manufacturers who have great information to provide. We're going to hear from academia, but the consumer and what the consumer prefers and is really where we've been investing all of our time, whether it be how do we communicate the difference between a homeopathic product and one that's proven by science, one that has an allergen, one doesn't have an allergen, encouraging Canadians to read the label, because sometimes there's things tucked in there that you don't expect or you wouldn't expect. So ultimately, that's really where we want to focus, is making sure that there's a balanced discussion and that you're sitting in the room with everybody else, hearing it at the same time as everybody else, and again, can provide that fulsome feedback. And I hope you found that the discussions are quite amicable and they're quite cordial. and you'll hear a diversity of views. But if you concentrate any one view, you're going to hear that particular view, but you're not going to hear all the other perspectives in response to that view. And so that's what we like to hear, is a bit more of not an echo chamber, but a dynamic discussion. And we've been trying to do that with all of our policies. So again, very much appreciate and thank you for your support in this.
Well, it's great to have patient advocacy groups, but I think it's amazing also for Canadians. They can participate in the consultations. Like, we were encouraging Canadians to have your voice, participate. There's a portal where Canadians can see what's coming up and write a letter and have their say. And we do know from past regulations, like changes to beer labeling and other issues. The government does listen, and if they see that there's hundreds of people or thousands or whatever the number are writing in and listening, not just a few patient groups, it just, again, as you say, it's more representative. You don't get that echo chamber. So it is democracy at its very best to help develop policy, and you can have your voice heard. So anybody who's listening, if we have other future opportunities, people do read those letters, and they do assess them into the final product, as it were. So what has the feedback been from the natural health product producers? I know what we think as the patient groups.
I would say that it kind of came into three little buckets, and we'll be engaging in the new year and trying to make sure that all these messages are spread widely. But really, it came into allergens and support for the allergy labeling. Huge support. Number one issue we heard back from was that.
Great.
The cost, I think a lot of people are concerned with the cost. Label changes are not cheap. And this has been a space where we really haven't done a lot of regulatory change since 2004, when we introduced the natural health product regulations. So now, as we introduce these costs, that the companies are much smaller than, say, a big pharmaceutical company. And so just managing that compliance, but what we see is a willingness to comply, but making sure that there's enough flexibility and enough risk-based approach so that, again, it's not one size fits all. And so working on that has been really fundamental. And then I think we've heard really strongly that Canadians want to make sure that this is actually enforced. And that, the rubber hits the road when someone goes out and looks and makes sure that that information's on there. And one of the key places that we heard from just recently from the Commissioner of the Environment and Sustainable Development, which is in the Office of the Auditor General, they said that it can't be just the physical label. It has to be the online label too. And so one huge component of the policy that we're going to be coming out with will be making sure that the online product reflects the information that's on the product in the store, because online is a store and it needs to be reflective and provide Canadians with the information they need to make an informed choice. About a year ago, you couldn't find Canadian information on the internet. I'm seeing it slowly start, but we want to make sure that, again, if you're looking at that product on x.com, that it has that allergen labeling the same as if the product were in the shop.
Yeah, that's a big issue for us right now. Like, and we know that more and more Canadians, especially through COVID, have been doing online, and we're doing our own research actually at the CCA on oats. Oats is there's gluten-free oats rather than regular oats, and we're doing some comparisons online, and the early results are like 50% of the online gluten-free oats are actually correctly labeled. So it's a big issue for us for accessibility. Not all Canadians can, if they're rural and they're, hours away from their closest shops, gluten-free is not necessarily readily available in all the assortment. So, our community may lean into a bit more onto the online purchasing, and they need to know that when they're shopping, all the information that they need is there as if they're standing in the store, and that it's correct. And then when it gets shipped to them, it's the same product, the same material, there's no substitution. Absolutely. So really glad to hear that. And we'll happy to be a part of those discussions, because that's certainly a big concern that we have been bringing forward at some of your stakeholder meetings last year and over the past while. So in terms of the labeling recommendations, what's next? We're not all, governance experts in terms of what's next, and how long will this process take? Then we can see it maybe perhaps coming into our own stores.
Absolutely. So what we're looking at right now is we finalize assessing all the comments. We kind of collated, we assessed, we've been briefing up on what we heard and what some of the changes that we might need to make. Believe it or not, when you're doing these things, sometimes there's mistakes, sometimes there's errors, and we have to fix those. And what we're trying to do now is make sure that, again, it reflects the policy that we've been talking about since the beginning of these discussions. And really what we're slated to do is look this year about moving that to what we would call Canada Gazette 2, or making it a law. So from the day that it's made a law, we would have a coming into force period of time. So we're hoping that within a year or two, you'll start seeing it on every single product that's newer. And then we're going to give some time so that people can sell off all the existing stock. Because again, we found it took a few years for the non-prescription drug industry to adopt to this. So we're hoping that within that 5-6 year period, all the products would have to comply. But again, we're trying to do it gradual and with some transition. And we've also learned that on the food side, because there's been so many labeling changes on the food side that they're trying to set a schedule so that, again, it corresponds with the natural labeling cycle of the industry. With that said, we would want compliance with the allergen labeling sooner than later. That's an absolute priority.
That's great. That's great to hear. And we know that your department, said a number of times on the calls that, the allergen labeling and the gluten labeling, the aspartame sort of had vaulted up near the top of the list, realizing what an urgency and what a concern it is for patient safety. So what about products that are imported? Do they need to follow the same, they'll have to follow the same rules as any products being, sold, made in Canada?
Absolutely. There are allowances for people who make a personal decision to go online and buy a product and bring it to themselves. So we call that a personal importation. But any product that is going to be commercially imported to be sold in Canada, 100% has to comply with that labeling. And again, that's a part we're going to try to beef up, and we're looking hopefully in that January, early February window to be bringing back the changes that we're proposing, anything that we're updating, and make sure that, again, we get that feedback and that consultation from the breadth of stakeholders that we deal with in this space. So we're really excited to be coming back now that the writ period is done and the caretaker convention, we can actually start talking again.
Oh, that's great. Yeah, and you're talking with us today. So, so anything else that consumers or patient advocacy groups can do? So you've sort of alluded in the new year, there'll be a chance to see what that stakeholder feedback. Is there anything that can be done? Should they be calling their MPs, or what would you suggest? Or is there anything at this point?
I would say two things. One is stay engaged. Just always be kind of checking in on what's new and working with associations like yourselves to make sure that, again, you're aware of the issues and what's pertinent, where we're going to kind of need some support rather than where, again, it's going to kind of go pretty easily. The second thing is think about the label. We really want to work with groups like yourselves to again raise the awareness of the label and to raise the awareness of how to read the label. And so we really look forward to working with health professional groups, consumer groups, patient groups, kind of after we get this proposal into law, and to work with how do you read a label and just basically break it down to the main sections so that it's consumer friendly. Because again, these products are only being more frequently bought and sold in Canada, not less. And again, that's not a bad thing. But we want to make sure that people know and quite often, you mentioned it a little earlier, people who shouldn't be using products tend to buy those products sometimes. And so we want to make sure that, again, if you have a heart condition and you shouldn't be taking that product, that it's clear and that people understand how to read labels. And I think, again, if you were to look at most labels, they're written at quite a complicated level. And so we want to work with groups like yourself to go through and say, what is that actual level of reading and education that it should be at? So that's kind of the big one is stay engaged and be involved. If you see a focus group or you see a survey come out, please respond to that, because again, that is invaluable information for us as we do our assessments.
We're happy to participate. We have a very engaged community. When we put out surveys, we get sometimes thousands of responses within 24 hours. So, and people with celiac disease know how to read labels. So we're happy to give you lots of feedback, and you'll get it. For sure. And you think of newcomers to Canada where English isn't a first language, and or literacy, health literacy levels is a big issue. So yeah, really important that people understand, know how to relabel, and if there's, as groups together, there may be some public health information that we can help all as stakeholders get out to our community channels and through to help make sure Canadians are informed. We all have a duty to be part of that education, for sure.
Absolutely.
So if a consumer does feel ill because they think there's been a possible gluten contamination in the food industry, they know who to call. They call the CFIA, which is the Canadian Food Inspection Agency. They'll often call the company and even maybe go back to the retail location, and often we get calls here at the CCA. So for food products, we know. So what is it for natural health if someone feels they've been cross-contaminated?
Yeah, I would love to say that our website's really easy to navigate, but sometimes it's challenging. The easiest way to look up is the Regional Operation and Enforcement Branch, and all you have to do is Google health product complaint in Canada. And that is going to be the #1 place where, if you want the government to take action, that's who you would want to report to. But also we want the company to know too, and that's part of the modern contact information. We want something that's really simple, whether it's a website or whether it's a phone number, so that, again, the consumer can reach out immediately and not have to go look up a government website and report that, because that company has to report that information to us. So again, making sure the company knows and that company will, in the vast majority of situations, take prompt action to make sure that situation is rectified by informing us, working with us, getting that product off the market if it were, say, containing gluten and it shouldn't be.
So what we can do is our team can maybe put a link to that health product complaint line. We'll get that from you, and we can include it along with the video and with our newsletter. That would be great, for sure. And I think that's important for people to know, when they've been ill, where they can go, for sure.
Absolutely.
So what's next for your department in Health Canada that our audience might be interested in hearing about?
There's a lot of interesting topics on the go in our little tiny sphere of the world. We really want to make sure that we bring a couple of frameworks up to date, and they're quite antiquated. Right now, we have a scientific advisory committee looking at health products that could contain cannabis. Right now, the only products there are no products that can make a health claim other than those that are prescription. And I'm sure if you go into certain stores, you might see them with health claims. But again, there's no legal framework for those types of products just as of yet without a prescription. And we also have, we're looking at the non-prescription drug space. Those rules were written in 1952 and last updated in a major way in the early 60s. And it doesn't reflect the space that we work in anymore. And we want to make sure that those are updated. And like I said, we just heard from the Auditor General's office, and what they want is they want more predictability that the products have been looked at, inspected, and that they contain what they should contain, should not contain anything they shouldn't contain, and that those claims are not false or misleading and beyond that which the department approved or authorized. And so right now we have a response, a management response plan to respond to the Auditor General's office. And we are looking at the natural health product regulations and saying maybe they need to come up a little bit to make sure that the product is going to be as good from day one to the end of shelf life. And right now, the Auditor General said she didn't have confidence that that was the case. So trying to make sure that these products are well made, they contain what they should contain, and again, low adulteration, and advertising. We're really looking at the advertising space to make sure it's cleaned up a little bit. Right now, the Auditor General found that I believe it was 95% non-compliance on a major retail website for companies. Yeah. That's
incredible. And, for us, so non-prescription would be something, I want to be careful of, like headache medication. Would that be something? Or
yeah. Yeah, medication, cough, cold, and flu. Some sunscreens. Yeah, it's those types of products.
So for us, anything we ingest, we want to make sure that you know, if there's non-medicinal ingredients, that maybe they're using wheat powder, you know, as a thickener or an agent, that, you know, consumers should know about that. Certainly, you know, as people take, and you think of Canadians who have more health impacts or, you know, diseases or multiple conditions, they're taking a number of drugs, and they want to make sure that, you know, by the time they've eaten, done this, and then they're taking whatever medications or supplements, they don't, you know, tip over that 20 parts per million. So they need to kind of be aware of what's in their drugs. And also prescription is another issue for us, certainly, to talk about another day. But so in terms of just almost wrapping up here, so where can people find out more information about these changes, or if they want to monitor or get on the Health Canada, you know, email chain?
Yeah, there's a site. So if you Google self-care framework, and again, we'll send you the link. But there's a self-care framework page, and there's a what's new section there. You could also sign up for the RSS feed, and you can also just email us directly and just get on our mailing list, which you are on. And so we make sure that we communicate on any major project to you. So again, I'll make sure that we provide it, but there's a what's new section on our self-care products page, which is buried within the website. And that will provide anything, any changes, any consultation results, any proposals that we're bringing forward. And it'll make sure that you're notified when we have something that goes out for consultation. And so again, signing up there's a little place to sign up, and we very much encourage people to sign up because it allows us to make sure that you have the most relevant information. And Canadians are really interested in this space, especially the natural product space, and they're very passionate about it. And so we like that passion, and we want to hear from people, and we want to make sure we can channel that into change.
Well, we certainly have a passionate group in the celiac community, very much engaged, very insightful, and always willing to give feedback. So certainly, yeah, I'm sure you might have a few subscribers after this. So we've run out of time, but so thank you very much, Matt, for sharing your time and insights with us today. Health Canada does do a lot of important work protecting and advancing Canadians' health, and we're pleased to be a partner in that work. So thank you for taking the time with us today. I'd like to encourage our viewers to watch any past episodes in our In Conversation series, to visit our website, or our celiac YouTube channel, and for these and a growing list of educational videos and resources. So thanks, everyone. Thanks for spending your time with us.